the little gastric tube down in my patient. But before we start on that, I am going to set our suction. Alright, I have my cords and everything ready. Going to turn it on, just to regular intermittence, just to make sure it's suctioning right, which it is. Also checking the gauge as well, suctioning right. Going to connect my vacuum. Okay. Also going to make sure this is right, this is suctioning as well, before I connect the elbow to the tube. Okay. And this will go in with the patient. Keep it down. This one just be here. Yeah, that's what Alright, introduce myself. Hello, my name is Faith Rappel. I will be your student nurse for today. I'll be inserting a nasogastric tube down to decompress your stomach. Make sure I get their name and date of birth, if they're allergic to anything. Alright, I'm gonna ask my patient if they have had this experience before. Have you ever needed a nasogastric tube before? No. Alright. Well, as I said, this is just to decompress your stomach, just so you can be able to have a little bit more secretion that needs to be out. Okay. Going to make sure I have everything ready, get it set, raise the head of the bed so high phallus position is already in that position, and that is just to make it a little bit easier for the patient and also for me as the nurse. Okay, my tube has been soaked in cold water, and that is just to constrict it a little bit, to make it a little bit easier for the when going down into the patient. Just going to wash my hands, perform hand hygiene. Put on my gloves. Okay. Just going to measure this just to make sure I have the right length. It's going to be from the nose, tip of the nose to the ear to the xiphoid process. Which is about 50. Tape it. Okay, now I am going to lubricate. Okay, and before I do all that, I have to offer the patient a tissue just to blow their nose, and I'm also going to examine the nares area just for proper skin integrity, and just to make sure there isn't anything, or clean it as well if it's dirty or it needs to be cleaned. Make sure the patient blows their nose just to have that little patent nostril. Okay, check for the nose area, just palpate. Okay, and we're going to be inserting it into the right nose. Alright, I'm just going to take the patient to take a deep breath and breathe out, and they're ready for the procedure. Just going to extend the head a little bit as I insert it. Okay, now I see some resistance. That means it's in the nasopharyngeal area. I'm going to have another nurse give the patient water while I continue the insertion. So if you can just go ahead and sip this water from me and just continue to sip. Let's flex their neck to the elbow, for the elbow touching the chin, touching the chest. Okay, sip. Just continue to get a sip of water. Continue to get a sip of water. Keep sipping. Keep sipping. You're doing good. You need to encourage the patient. Okay. Keep sleeping. Alright, it's in the right area now. And now we can be done with the water. Just going to clean my tube a little bit. Just tape it up a little bit. We're not going to fully tape it just because we have to get it checked by X-ray before we tape it completely. I'm just going to change my gloves since it's a little bit filled with the lubricant. Okay, now I'm going to check for proper insertion as well before they take my patient for an chest X-ray. And to do that, okay, and this is where it's going to be locked, but I'm just going to leave it open for now because I am going to check.
Yes, I'm making sure you like that, and then
so I'll just insert air while hearing, listening, oscillating his abdomen just to hear for goggles. And if I just hear a little bit of goggles on bowel movements, that means it's in the right
So here's that, and then we're going to go ahead
and doing this with my gloves on, of course.
Come in, form his hygienist on gloves, and explain to the patient that if they're going to get their NG out, I'm happy about that. But before I do that, I want to make sure that the order.
Alright, I hear some goggling. That means it's in the right spot. That's good.
Put it back in and make sure that I don't question the orders or anything. So
with gloves, though. So we're just going to close it up a little bit. Close it up, make sure there is nothing going into the patient, so I'm not going to connect it to the suction or feed the patient until I get that X-ray from that go-ahead from after his X-ray has been done. And also when I was inserting that, if my patient felt a little dizzy or starts vomiting, I have to make sure I just withdraw it a little bit, stop for a little bit to make sure the patient is alright before I continue. Alright, the X-ray has been back. I have the go ahead now to continue with my patient. So I'm just go ahead and put my gloves on.
And so then after that, I'm going to take off my gloves, do hygiene and back to my take this out and
so to check for proper placement, you can either use an X-ray or you can use a pH. And with a pH strip, it has to be less than 5.5 to make sure that you are in the right spot. And now, so now I will be connecting my nasogastric tube to the suction. But before I do that, I have to, even though with the I've gotten the go-ahead that with the X-ray that it's in the right spot, I still have to aspirate with a 30 milliliter of water. So draw my 30 cc's of normal saline, not water, normal saline. And that's just to make sure the patient vomits or anything, they're having that electrolyte, just for that electrolyte balance. Okay. First I'm going to aspirate and then flush it in. Okay, I see some green, pea green color, so that means it's in the spot. So I'm just going to flush it in. Okay. Then I will connect it to my tube. Just leave it. And then you can always pin this to the patient's gown. That's it, like if they're moving. But if they're laying down, it's kind of like hard to do that. Well, not hard, but probably not safe, just because the patient can roll in the wrong position and the pin will unlock itself. So I'm also going to make sure I lock this up properly.
Wrapped up. throw it away.
Okay.
And make sure
That one piece going down. Okay, just clean the patients. Make sure they're okay. You can go ahead and lower the head of the bed to the comfortability of the patient. Clear your area. Make sure the patient is safe. The bed is back to the lowest position, and just make sure the patient it's all right. And then you have to document the patient's tolerance to the procedure. You document how much of normal saline you use to aspirate and to flush, and also you document if you use the pH level, if you use the pH strip to check for the right placement. You also document the pH level that you had when you checked it, and also check, make sure if the patient vomited during the procedure, you also document the amount that they vomited out, and just make sure everything is all right. I am going to document and then sign.